Good afternoon, Elder Justice Warriors. Thank you for making the time to be here with us this afternoon. I'm pleased to see you back, all of you back here today, so we can dive into this important topic and gain some new information. As always, a reminder that our program is interactive. And so we encourage you to use the chat and the Q&A to ask questions and engage with your fellow participants. So go ahead and get started now, and in the chat, add your name, maybe what you do and where you work. Really appreciate that. We look forward to getting to know some of you today. We also value accessibility. And so if you have need of closed captioning and ASL interpretation, please feel free to use it. It is provided to you today. And thank you so much for being here. As a reminder, we are here on the third Thursday of every month, and we'll be back again next month on June 18th. We will finish up our first year, and we will be welcoming our speaker back by popular demand, Paul Greenwood, who's going to talk about bringing elder abuse out of the shadows and what we can all do to amplify the voices of those who've been impacted. As a reminder, we could not do this without the support of many organizations, chiefly Kaiser Permanente, as well as our various planning partners like California Department of Social Services, California Commission on Aging, California Long-Term Care Ombudsman Association, California State Association of PA-PGPC, and California Department of Aging. Now, we are going to engage in a tough topic today, and I've invited two friends to join us who I think are going to be able to guide us through this conversation adeptly and with lots of humility and grace. As we all know, there has been an increasing rise in violence against Asian Americans, particularly older adults who are Asian Americans. And we as service providers, we have to be in it with them to engage them and have tough conversations. I also know that many of us come from nonprofits and small organizational backgrounds where we ourselves are still grappling with the work of what it means to create equitable and inclusive workplaces. And so today we're going to have some hard conversations, and I welcome you to, like us here at Ombudsman Services, to challenge yourself and sit with some of those hard things that don't quite fit at first glance. We're going to have sort of two conversations. We're going to, one, talk about the rise in violence against older adults of Asian American descent. And we're also then going to talk about what we as organizations and service providers can do to be more responsive to their needs, and what work we can do in our own organizations to make sure that we are really rising above the fray and providing safe places for all people to live and work. And so today we are going to start with Denny Chan. He is the directing attorney with Justice and Aging, and he is the inaugural attorney of Diversity, Equity, and Inclusion. And so with that, I'm going to turn it over to Denny. Denny, thanks so much for being here today.
Great. Thank you so much, Nicole. Good afternoon, everyone. My name is Denny Chan. I am the directing attorney for Equity Advocacy at Justice and Aging. Really happy to be with you all today and talk to you about an important topic that is both really important to us as an organization at Justice and Aging, as well as important to me as someone who is of Asian American descent myself and who has older adults in my own family. Before I hand things over to Edie, I'm hoping in my conversation to really unpack an overview of Asian American and Pacific Islander older adults, kind of give you a sense of what their big issues are in facing that specific community, and also talk about what issues they are facing, as well as some recent current events. But before we get there, I want to talk a little bit about Justice and Aging in case you haven't heard of us before. We're a national legal advocacy organization that is dedicated to fighting poverty, fighting senior poverty in particular, using the power of the law. And we focus on a couple of main program areas, including healthcare and long-term services and supports, economic security, including a growing amount of work in housing for older adults, low-income older adults, as well as elder justice and elder abuse. For the past 49 years, we have focused our efforts on fighting for those older adults who have historically faced and continue to face discrimination, such as older women, older people of color, LGBTQ older adults, and older adults with limited English proficiency. And just 2 months ago in March, we launched a new initiative, our Advancing Equity Initiative, which I'm happy to be leading in the organization. So before we talk about older adults in particular, I want to do some ground setting on who is included in this umbrella term of Asian American and Pacific Islander, or AAPI for short. It's actually a very diverse community. It is not a monolithic community. And so that simple four-letter category actually includes a number of countries, including over 30 different countries of origin, over 100 different spoken languages, people ranging from East Asia, Southeast Asia, the Indian subcontinent, and the Pacific Islands. It does not include, for example, the Middle East. It does not include, nor does it include Northern or Western Asia. And according to recent census data, it is clear that the Asian American and Pacific Islander community is actually one of the fastest growing groups in the country. And so although it's not a huge community population-wise, depending on where you live, it is one of the fastest growing. Next slide. And now what about Asian American and Pacific Islander older adults? They constitute over 5% of the total older adult population, individuals who are 65 and older. And among the Asian American and Pacific Islander community in the United States, they constitute over 10% of that population. As you can imagine, the significant concentrations of AAPI older adults is in several states in particular, largely focusing on California, New York, Texas, and Hawaii. All of those 4 states combined actually have over half of the Asian American and Pacific Islander older adults 65 and up. So it constitutes significant concentration in those 4 states alone, which is why it's really important that I believe a number of you are from California. But that's not where some of the fastest growing pockets are. In fact, it would be a shame to sort of think that Asian American older adults, Asian Pacific Islander American older adults live in those 4 states alone. In fact, some of the fastest growing pockets are in areas like North Dakota, Minnesota, South Dakota, Vermont, North Carolina, Texas, I'm sorry, not Texas, Tennessee, Georgia, Florida, Wyoming, Indiana, and Texas. So Texas is one of the bigger states, as well as one of the fastest growing states with respect to population of Asian American Pacific Islander older adults. I also really want to take a moment and just sort of unravel this notion of what we call the model minority myth. It's this largely ingrained stereotype that Asian Americans and Pacific Islanders are doing well, that they work hard, they are well educated, and so they don't have the same issues and same economic troubles as a number of other people of color. That's categorically false. And in fact, if you look specifically at Asian American Pacific Islander older adults who are 65 and up, they actually sometimes have higher rates of poverty compared to white older adults, and sometimes even compared to other older adults of color. So here I've sort of delineated a couple of notable groups: Bangladeshi, Burmese, Cambodian, Chinese, Hmong, Korean, Micronesian, which I apologize, there should be an N in between the O and the E, Nepalese, and Vietnamese. All of those groups have significant amounts of poverty. 1 in 4, 1 in 5 older adults in those communities live in poverty. And we all know that the poverty mark actually doesn't accurately capture how many people struggle to make ends meet. So this is actually an undercount. If you are thinking about older adults, AAPI older adults who have trouble making ends meet, this is really just a portion of those individuals. Compare that to other older adults. White older adults, their poverty rates hover slightly above 7%, Black and Native American at 19%, and Latino at 18%. So you can see that actually this notion that AAPI older adults might be faring better than other groups, once you break down the data and look at specific groups of AAPI older adults within that community, you can see that that's actually not the case. And they are actually sometimes even worse off by looking at these numbers. Next slide. As I said before, the AAPI umbrella includes over 100 different spoken languages. And when we're thinking about older adults in particular, they're often immigrating to this country if they're not native born. If they're immigrating to this country they're actually coming at a time when picking up English as a second language isn't going to be necessarily the most intuitive or the easiest for them if they haven't actually been educated in English before. So nearly 60% of Asian American and 25% of Native Hawaiian and Pacific Islander older adults 65 and up are limited English proficient. That is a formal census designated term of art that says basically that the person has difficulty understanding, reading, or writing English. It doesn't mean necessarily that they're monolingual in their native language. It does include those individuals, but it's people who have some difficulty with English, significant amount of difficulty with English. So you can see that that's well over half of people in this category are limited English proficient. In addition to that, many of those, especially those who are LAP, live in linguistically isolated households. Again, another really fancy census term to say that no one above the age of 14 speaks English very well. Those two factors, limited English proficiency and linguistically isolated households, correlate with poor health disparities and a poor quality of life. You can imagine that if you don't speak English or if you don't speak English very well, you're going to have more difficulty sometimes interacting with systems that are set up mostly for English speakers. Next slide. So I wanted to give you a sense this is not an overly inclusive list. In fact, it's probably underly inclusive of the hot issues facing AAPI older adults as we see them. One, given the amounts of significant poverty that exist for AAPI older adults, it's clear that safety net programs like Medicare, Medicaid, SSI, housing assistance all really matter. And so I think that's a really important issue, especially during COVID-19. How do you continue to access those programs and make sure that those programs are meeting your needs? For example, under safety net programs, including healthcare, a big topic has been access to the vaccine. Are you able to get a vaccine in your community? Do you have to go really far? Are people there who are administering the vaccine speaking your language? Is even the registration process in a language that you understand? I'll say anecdotally of the older adults who I know of not a single person who successfully navigated this whole vaccine process themselves. And AAPI older adults are no exception to that. A number of people have had to rely because of language barriers, tech issues, on others. And so that's a really big issue is how do we make sure that those services are accessible to AAPI older adults? Along with accessibility, I think right up in that includes language access. When I had said over 60% are LAP, that means that over 60% will need some form of language assistance services, whether that's telephonic or in-person interpretation or translated materials, translated documents. And I'll say that, unfortunately, recent federal policies under the previous administration have made it much more difficult, especially in healthcare, for Asian American and Pacific Islander older adults to access those interpretation services or even know that they have a right to those interpretation services. As I said before, this is the same community that, because of their limited English proficiency, tends to have worse health outcomes. And I talked a little bit before about vaccine access. A lot of the national data indicates that AAPI individuals do not seem to be at necessarily higher risk of catching COVID or being hospitalized or dying from COVID. But it's also true that all data is subject to how you cut and slice it. So if you were to look more specifically at San Francisco, for example, you can see not only that our vaccination rates tend to be lower in communities where AAPI older adults reside, but also that there actually are higher rates of infection for COVID-19. So I would encourage you to think very carefully, given the diversity that exists within the AAPI community, to think through, is national data that tends to have just lots of averages, is that really masking local trends? One of the last issues before I get to the rising amount of hate is around cultural competency. Here, it's really important that Asian American Pacific Islanders are provided services in a culturally competent manner. I give this example often. So my grandmother, before she passed away, was in a skilled nursing facility in a community that largely where she was not in a majority. She was one of the few Asian American patients. And, there were lots of issues because she lived in the skilled nursing facility. But one of those issues was that she didn't eat the food regularly that they gave her because she wasn't used to that food. She wasn't used to eating salad. She wasn't used to eating those things that they were serving. And so my family had to go out of their way to make sure she actually got food that she would want to eat. Because the last thing we would want is for her to not have the nutrition that she needs in the facility. So even down to those things, it's not just about making sure that you have translated materials and have language access policies, but also that the services you provide are recognizing the lived experiences and the cultural preferences of that person. And then last, I want to touch on racial discrimination and rising anti-Asian American hate. This is a really big topic as of late. It sparked this conversation that we're having today, and also to say that this is not new stuff. If we go to the next slide, I think I have some examples. This is really part of a trend. We're talking about it now because I think social media and other things have made it much more apparent, have captured the everyday hatred that AAPI individuals experience. Sometimes, there's a term called the perpetual foreigner, that no matter what we do, we're always going to be not welcome in this country. But this is it's a part of a historical trend. So it began, even as early as the country's founding. The Chinese Massacre of 1871, not too far from where I live in Los Angeles, was the brutal massacre of dozens of Chinese men, specifically in the 1800s, followed quickly by the Chinese Exclusion Act of 1881. That was the first time this country issued a law barring certain people from coming into this country. As recent as the Vincent Chin murder in 1982. So all of that spells out a pretty long and lengthy history of violence and hatred and xenophobia toward this specific community. I think what's interesting about this recent wave of attacks, some of which sometimes people call random, but I don't think it's random at all. I think it's pretty targeted, is that there's a specific targeting in times of older Asian American women. That's really important for us to flag because we're talking today about older Asian American AAPI older adults. There's something about that intersection of race, of maybe it's part of the COVID-19, the blaming of the COVID-19 pandemic on people who are from Asia, but also this perceived vulnerability of older women, that they're not going to fight back, that they're too weak. That one thing that's we have not seen as much talked about is that a number of the victims, not exclusively, but a number of the victims are actually older Asian American women. And I believe that's not a coincidence. I think there's something happening about people's perceptions of older Asian American women that is making them more prime as a target. It's really important that in thinking about anti-Asian American hate, that our policy solutions are community-oriented, grounded in what the community wants, and acknowledges the racist underpinnings of our police system. This is not an opportunity to add more resources to law enforcement necessarily in a sort of broad brushstrokes manner. This is an opportunity to really think about how we do policing, what it means to have restorative justice, and how do we actually better serve AAPI older adults. There was a op-ed that ran recently with the title that we're going to need a lot more than a hate crimes law to feel safe. And I think that speaks to, what do we need to do to address the underlying root causes of anti-Asian American feelings and sentiment. And that's really how we get at this problem. More resources to law enforcement won't necessarily solve it. It might help with a symptom, perhaps, but it's not going to address a root cause. I will note, and so when I submitted these slides last week, the Senate had passed an anti-Asian American hate crimes bill that was passed earlier by the House this week, and actually President Biden is signing today. So this is an issue of national attention. It will continue, unfortunately, I think, to be an issue of national attention. But I don't want people to think that it is certainly a new issue, because it is part of a long time trend where Asian Americans have been targeted because of their racial identity. Next slide. So I think with that, I'm going to turn it over to Edie. Hopefully it wasn't too depressing, but I'm going to turn it over to Edie, who can talk a little bit more, I think, about what we all can do on a local level to best support AAPI older adults. Thank you.
Great, Denny. Thank you so much for that overview and for all that information. You're a hard act to follow, so thanks. Well, I'm Edie Yao. I'm the Director of Diversity, Equity, and Inclusion at the Alzheimer's Association, Northern California, Northern Nevada chapter. And, you know, I think many people have been disturbed by the recent rise of discrimination and violence against Asian Americans, and particularly older women, as Denny had pointed out. I wanted to start with a personal story that several months ago, when we were starting to see a lot of this happen in the news, I went to go get my haircut. And my hairstylist is a Korean American woman. And I went in and she said, Edie, my shop has been robbed. You know, they stole everything. They broke into my shop, and she was so upset about it. She said she had reported it to the police and that nothing happened. And she was afraid to work late at night. She made sure to rearrange her schedule so that she'd be out of there before dark. And she was just so, you know, just visibly upset about it. And I felt helpless and wondering, what can I do? Because I certainly was upset about this too. And so what I ended up doing was actually I wrote to my city mayor and council members. And I wrote, Dear Mayor and council members, as a Chinese American resident born in Santa Clara, I'm concerned about my safety and my family's safety with the rise of anti-Asian American hate crimes. And I talked about my hairstylist and what happened to her, and that the police had not done anything since reporting it. And I mentioned, you know, we're fortunate to have a number of Korean and other Asian businesses and restaurants that call this city home. But what is the city doing to protect and stand in solidarity with our Asian American community? Concerned citizen Edie Yao. I sent that off thinking, I don't know what's going to happen to this email. Lo and behold, I got an email back the next day. And Dear Mr. Yao, I often get my pronouns mistaken, but anyway, it was from the chief of police, the assistant chief of police, and he immediately wanted to schedule a meeting with me and wanted to discuss what was happening. And, you know, we scheduled a Zoom meeting. I have to say I was kind of intimidated to have a meeting with the assistant chief of police because I have never done that before. But he was just remarkably open to listening, and also provided an update on what had happened. They did investigate the situation and they had an update, and it took a little time, and they had already communicated that with my hairstylist. But things started to take on a life of its own. But, you know, it was, I share that story in the sense from a personal standpoint when so many of us feel like we're outraged, what can we do? That there are things we can do, and that we can be allies in so many ways, and that our voices do matter. I think what's also notable about this story was I learned that they particularly were impressed that I was acting on someone else's behalf. So they, you know, they may get reports from victims, as they should, but the fact that I was reaching out on behalf of someone else outside of my immediate circle, really, that they took it very seriously. So I think that's, you know, worth noting. So then we take it to an organizational level. How can we be allies as organizations? You know, we've seen a lot of organizations issue public statements in the past 14 months. And I think there's good intention behind those statements. Their statements are against racism or discrimination, making pledges of support to social justice. But I think what's really important to think about is then what are the outcomes that they're trying to achieve? And maybe what's more important is thinking about what action plan do they have in place to demonstrate this commitment that they're putting forth. And I think that's what communities are really looking for. So to give you an example, in this slide at the Alzheimer's Association, our Northern California, Northern Nevada chapter, for several years, we looked at, in addition to my work, which is overseeing our diversity and inclusion efforts, raising the visibility and of our work in underserved communities and reaching out externally to constituents of color, including our Asian constituents. But internally, we were looking at what can we do as an organization, as a chapter, to improve our position around DEI, diversity, equity, inclusion. And so when I'm talking about building out a strategic plan or strategy for how you demonstrate this commitment, it really does start with that internal process. We formed what we call a DEI council, made up of our staff from across functions. So not just people of certain functions, but really of different management level, staff level, different functions. And I would encourage you to assess the current culture of your organization in regards to diversity and inclusion. Also looking at educating your staff and volunteers to increase the awareness and develop skills around this. That was something we were seeing, is our staff really wanted to develop stronger, better skills in how to be an ally and how to make sure that everyone has a sense of belonging. And then that measurement piece is really important. Think about how you're going to measure the success. And there are tools out there that you can use to create a plan and then to actually measure where you are in that continuum of DEI. Next slide, please. Just to kind of flesh this out a little bit more, to give you some examples, through our assessment that we did, we identified some priorities. And one was to look at our own recruitment and hiring processes. You know, how do we recruit people? How do we conduct the interview process? And who determines who gets hired or not? Yes, we have an HR person, but really starting to look at, you know, what does culture fit mean? How do we examine what's the right qualification for various positions? We also developed some DEI values and standards. So, you know, bringing people together within your organization to put together a statement. Do you have a statement on diversity, equity, and inclusion? Not just for bad times, but for all the time. You know, what are our values? And really bringing people together to think about that and create standards that you all believe you want to live by. And then the last piece is really looking at, does everyone understand what those values and standards are and what that means? And I think that's an ongoing process of how do you communicate out, both in writing and in different mechanisms, but how you actually demonstrate that is really important. The slide here has, let's just go back. This is a rack card that was developed as one tool for enhancing our recruitment efforts. And so we had developed a rack card with our human resources team and with the DEI Council's recommendations to look at, do we highlight diversity and inclusion in our talent recruitment, collateral and whatnot. So that's one example of what you can do. Another, I think, more good example of what we've also done is, when we're talking about discrimination and racism and the current crises that we've seen around social injustice, is to think about how do you support your team internally. And one of the things that we did was to actually carve out time and set aside time and have that conversation and allow people to share and reflect on what's going on for them during the situations that are happening. And what we found was that staff really appreciated having that time. So part of that strategy of building a DEI culture is allowing people to process, and not just certain people, but for the whole team to be able to process. And they really appreciated being able to talk about, one, what was happening for them. And in this remote world, it's hard to separate what's home life and what's work life, because it all starts to really blend together. And some of our staff were not feeling safe, in their day-to-day lives. One of the things that came out of that conversation was one of our staff members actually was, I think, really motivated and inspired to do something. And so as a representative of the organization, she actually reached out to some local businesses in her region to say, here we are, we're here to support people who, older adults, but anyone in our community. We're the Alzheimer's Association. She specifically was reaching out to Asian American businesses. And one of them had responded with, "Thank you so much for reaching out. We're so appreciative of your support." And, so you can take something that may seem like such a helpless situation, but really empower your team and build that culture of allyship into the work that you do, no matter what organization you're from. Just trying to see what else I was going to say about this. I think before we go into additional questions that our group has here, I would just also add that standing up for racial justice is a long game. We didn't get here overnight. What we see happening, particularly around discrimination, xenophobia, with AAPIs, this is not new. This has been going on for generations, as Denny had pointed out. And so there's no quick fix. And so I think really when organizations are looking at how to be an ally and how to make things better and really to stand up with the community, for the community, you start with the intention and you lead with the commitment, but you don't stop. So, and that's, I think, a lot of times what we see is, again, that empty public statement. But if you really have the intention and the commitment, it's really thinking about what is your long-term strategy for partnering with communities of color, and looking at the long game of how we can be better, do better, right, for all of our communities. So let me stop there. And actually, this slide is really just some examples that we had shared with our team, 10 actions to address and dismantle anti-Aapi and misogynistic hate. And so, practical things, interrupt jokes. These are, again, from the personal standpoint, opt out or unpack the script of shows or movies that fetishize or hypersexualize AAPI women. Again, we're seeing this perception that older women or Asian women have this certain perception and this vulnerability, and we can stop that and change the narrative. Next slide. You don't have to be AAPI to speak up for AAPIs. So certainly being that voice as an ally is critical. There are many organizations that we can donate to, petition the media, write to your city mayors or legislators, volunteer time to support community-based organizations, and certainly report anti-AAPI violence, as we've seen multiple times reiterated in the news. Diversify your social media feed. One of the things I remember from a friend a long time ago was saying, who do you invite into your home? We can't invite people in our homes quite yet, almost, but just think about in your circle, in your network of friends and the people you communicate with. Do you have AAPI colleagues that you talk to intimately or listen to? So that can be social media or also through reading books by AAPI authors, and then also supporting AAPI-owned businesses. One of the things I think is interesting is sometimes I hear people say, oh, I love this Thai restaurant I always go to. What's the name of it? And they don't know the name. It's just this, to them, it's a generic Thai restaurant. And I think, an example here would be, one, know the name, know how to pronounce it, but also, do you know the people there? If you're a regular, do you know the people there? Get to know your local business owners and the people that you support, right? They're not invisible. We have to do our part to make sure they are visible. So I think that's it. And I'll turn it back to Nicole. Thanks.
Thank you, Edie and Denny. We appreciate your presentation. I just want to draw everyone's attention that Edie and Denny have both listed their contact information for you to reach out to them. And I highly encourage you guys to get that information so you can connect with these experts directly. So I want to thank both of you also for being vulnerable, both personally and professionally, and really outlining some tough conversations. We're going to go ahead and start diving into questions, and I invite everyone to add their questions to either the Q&A or the chat so we can bring those up for conversation. And I think I'm going to start today with Denny. As you're sort of outlining the numbers and what's going on in our world today, I sort of could almost hear like an argument coming up of like, okay, but how do we know it's not new, it's just being reported. Like this has always happened. Like, how do you actually indicate no, because of some rhetoric going on, that there really is an increase in this type of violence? How do we kind of have that conversation with ourselves and with others?
It's a really interesting point, Nicole. I think there's been a lot more reporting of incidents. Social media, as I said before, helps, proliferate events. But honestly, I don't actually know if the question about whether it's new or old matters ultimately. Regardless, the incidents are manifestations of underlying hate and are making older adults in our community feel not safe and vulnerable. So regardless of whether you want to start the clock at the Chinese massacre in the late 1800s, or if you want to start it after the COVID-19 pandemic reached our shores and the certain language of elected officials, where you start that clock to me is less of an important issue, as much as, to Edie's point, like what are we doing directly to meet the needs of people in our community, ensuring that they're safe and are able to access services. What I would also add is that, underreporting of hate crimes remains a really big problem. The federal legislation that President Biden is signing into law today helps with some of that, but that really remains a big issue. There are a lot of reasons why AAPI older adults and others don't report things that happen to them. I'll give you an example. This isn't necessarily a hate example, but it's an example of someone who was an LAP older adult, Asian American gentleman, who didn't get a reminder for his appointment, his medical appointment, in language. He got it in English, and then he missed the appointment because, of course, he didn't understand the notice that he got. And he went about a week before he could reschedule the appointment and get the drugs he needed. He had some complications during that week because he ran out of meds. That's an everyday experience of an Asian American older adult because they don't expect these systems to work for them. Did he go report that to a legal aid attorney? Did he go find a social worker and say, help me figure this out? No. His family scrapped together and got his appointment rescheduled, and he's fine now. Several months later, after I talked to him, he had almost forgotten it happened, right? Which isn't to say that that's the standard, but it is to say that these are things that people are dealing with every day. And so there are a lot of reasons why these incidents don't get reported. But again, to me, where you start the clock doesn't matter. The point should be, what are we doing to better serve these individuals?
Denny, when I heard you talking about the family coming around that individual, it struck me that that same issue then also feeds into this idea of the model minority myth of like, oh, it's a good community, they'll take care of each other. And just the idea that you're able to get the thing you need doesn't mean you're actually addressing the trauma. And to your point, that gentleman didn't even really remember it a month later, because he's had so many instances where service providers haven't met his need, it's not novel to him anymore. Yeah. So I'm wondering.
I'll also say, just in response to that, to make it a little more like a conversation, that I think it's really important to remember a lot of AAPI older adults, especially those who are immigrants, are coming with a certain set of cultural values that really are quite different than how we might encourage civic participation and participation in society more broadly. This notion that, to your point, that, a lot of things might have happened to him. He probably didn't say anything each of those times, right? So there is this kind of, even in my own, with talking to my own grandma, this notion that like, it's fine, we'll do what we can. There's almost this notion that like, even though, for example, like with my grandmother, she is a naturalized US citizen, that she's still in someone else's country. It's interesting how that perpetual foreigner notion gets internalized to some extent, because she's not here to rock the boat. And a lot of the things that we would ask them to do, to report hate crimes, to tell someone they didn't get the language access they needed, might be considered rocking the boat for them. So I think that's a really important piece to remember when serving this population.
Yeah, thank you. Edie, I think that leads us into our next conversation, which is, as service providers, how can we work to be culturally informed and aware of how, if an Asian American comes to us, they've experienced a crime, how a lifetime of other incidences may have affected how they experience that trauma? How can we as service providers be aware of that and be connected to them and help them address those concerns without overstepping boundaries?
Well, I think one, we have to do the work, right? We have to educate ourselves about Asian American culture and the historical trauma and just the history of Asian Americans in the United States. There's a real push for including Asian American experiences in education at an early age, because so often we don't see enough Asian American history being taught to our citizens here. So doing that work and understanding the experiences there. And then I think it starts with building that trust, understanding they may not divulge information to you if they don't know that you're a trusted source. And I think, yes, it helps to have Asian American representation. Language is certainly important when we're looking at cultural competency, especially when we're dealing with older adults. But again, I always go back to that intention. And so if you don't have staff who speak that language or who represent that community, are there other ways to, demonstrate, again, that trust in the community? And you can do that through partnerships with other Asian American organizations, perhaps. There are lots of different ways of going about that. So I think that's really important. And then I think, if you don't have, if language is an issue and you don't have someone, there are ways to, again, partner with other organizations to provide that language access, or hire a translator, right? That's another way of going about it. There's a language line that's always available with 200 languages, and certainly that's another avenue. But people aren't going to come into the door if you don't, if they aren't aware that they have that you have their back, that you in fact understand the AAPI population and their culture and are a trusted source.
Edie, it strikes me that to that point of, even if you have a team member that has language, is bilingual, that team member in terms of the organization also needs to have some organizational authority and leadership, that it's not simply enough to have language accessibility and put out that social media statement, that we need to look internally to see how power is allocated and who is raised up and how challenging conversations happen if we're really going to model that in the broader community.
That's right. That's right. It goes back to the organizational culture, right, around diversity, equity, and inclusion. Is how is this embraced as an institution, really, right, and not just putting this one person, because it's not enough to say, oh, well, I have this one staff member, but one of the things organizations do. I understand lack of resources, but who is the interpreter sometimes? And it might be at schools, it's the kitchen help, or you rely on the child of that client, right, to interpret. So if you're providing care consultation, that's one of your functions of your organization, and you serve or you have in your community a high percentage of Chinese Americans, hire someone who is that function, right, of care consultation in that language that's needed. And then also, but again, bridging that whole cultural support for Asian American community is part of it.
You led me right into the next question. This is to either of you, which is, how can we find the best translator to various languages? And how can we know it's accurate? Because if we don't speak that language, right, we get it back, we have to assume it's correct. But then I've sometimes heard later on a community say, well, that's not exactly what it said. So how can we ensure that we're looking for language translation, that it's the right dialect, the right nuance, and it's striking the right tone?
Well, that is a challenge. I think you really need to start with, again, assessing your community, assessing the population that you are trying to reach, and make it a priority, right? And then hiring for people who speak that language. I think we could probably spend a lot of time talking about this. Medical translators may be able to do something, but I can tell you, for example, with Alzheimer's, we have worked really hard to change the vernacular around Alzheimer's. And so what's often translated as Alzheimer's in the colloquial term is very derogative. And so we've moved away from that So if we relied on just a translation service, they may translate it as that colloquial term of crazy catatonic disease, where we've translated the phonetic term for Alzheimer's disease. You know, those nuances take time to work through. And so depending on your organization's specificity, it's thinking about building out that vernacular that's appropriate. Again, I can't emphasize this enough, but it's really working with you know, that community in terms of who you want to partner with in that sense, and then looking at the translation. Sometimes when organizations are thinking about, well, I don't know what it says, so how do I know if I can trust it? There is a whole back translation process you can do through translation services. I also think it's really important to build trust within the community that you're trying to build relationships with, to know that, to hear their voice, and not just through a back translation process. Because again, who are we centering in that process when we're trying to build relations?
You know, I would add, I think Edie's right on the money there. I would also add, you know, like an example of that would be to do some consumer testing, get something translated, and then actually you're probably translating because you have clients you're working with who are monolingual or LAP. Test it with those clients, see what you get back, and, you know, in response, is it actually information they understand? And that not only is just about some of the things around vocabulary and word choice, but also like, is it readable, right? Because you want to add a reading level where people are going to understand. And sometimes that gets lost in translation as well. The other thing I would add is, you know, there might not be a perfect answer. You know, there might be some challenges if you go with the language line route. You might not have, you know, a budget to pay a bunch of interpreters. But there certainly are things that, like, low-hanging fruit of things not to do. So for example, you know, in the COVID-19 vaccine process, a lot of county health departments solely relied on Google Translate in their web pages for people to sign up for appointments. That's pretty clear that Google Translate is not going to capture meaning as well as it would capture just like a word by word translation. So there are certainly things that, like, yeah, you'll have to make some hard choices because it's not going to be perfect either way, but there are things to avoid in that process, regardless of, you know, the hard choices you have to make.
Yeah, you know, Denny, I appreciate you adding that, because you're right. I think it is important to test among consumers or your constituents. Focus groups are great ways, but also in a pinch, you know, Google Translate, do you have a press release or something and you need to put out or whatnot? Google Translate might be the first go-to, but then if you can find a trusted source to review it, that's so important, not to just totally rely on Google Translate, but have someone review it, because again, that regional difference or literacy level is really critical.
So I'm sure you both, again, you work in this industry. So, you know, diversity, equity, inclusion is about a lot of things. And our audience here is very smart, and they've rightly raised, you know, where does age diversity fit within this construct? When we're working with the AAPI community, is there a difference between, say, an older population who is sort of having one approach versus maybe a younger community, which is having a different experience and approach? So how can we as service providers be sensitive and aware of that?
I feel like that is a question that is hard to answer succinctly. I can try my best to say, you know, one thought would be to really think about things with an intersectional approach. That, you know, when we're thinking about an older adult, you're also thinking about their gender, you're also thinking about their race, the language that they speak, and not to divvy it up just in such a sort of binary construct. I think that goes a long way, because honestly, if you think about, you know, even the point I was trying to make earlier was like, there's some specific targeting happening right now, right? It is not exclusive, but if we use broad brushstrokes, older AAPI women are being targeted. That is a pretty specific, it's not unique, but it's a specific disparate outcome that's happening to that population at that intersection in a way that's not happening to other groups. So I would encourage you to think about that like age is another layer on top of everything else that's happening that inserts its own layer of complexities, right? To think about added things like mobility issues, the issues around language access. If you're coming to this country as an immigrant in your LEP, you're more likely to have opportunities to learn English. And when you're, as opposed to someone coming in their 60s or 70s, and more of the brain development around language has been more locked in. So I think that there's ways in which age introduces a lot of complexities that either solidify or bring up unique considerations. But it's really important to think holistically as a sort of intersectional framework. What are all the different things that person is living through, which are complicated by age in a way that makes it hard to figure out like a one size fits all. I think both what Edie and I are trying to say is like a one size fits all approach doesn't work. And so it's important to consider how that age identity of the individual adds a layer that wouldn't otherwise be present.
Edie, do you have any thoughts on that?
Just, I think what comes to mind is just there are generational issues, right? And so I think it's kind of saying the same thing. It's just that, you look at the different generations and think about political persecution or language issues. I think about the Vietnamese population and the communities, and thinking about when they immigrated here matters, because there's a serious political difference in how they approach things, and maybe how they trust or distrust government services. But I think if the broader question is age included in diversity, equity, inclusion, it absolutely is. So yeah.
So we're coming to the end. So I want each of you to close out with this sort of one thought. So what is something that you do for yourself and for your organization to keep this conversation moving forward when it is so easy to get so discouraged and down about the violence happening? So Denny, can we go to you first?
Sure. It's hard to say, think of one thing. What I would say is, I think it's really important to think about the AAPI violence or anti-AAPI violence in a way that celebrates the resiliency and vibrancy of the people we're talking about. To your point, Nicole, that the frame or the notion that these are victims and there's a lot of violence, that has a lot of trauma attached to it. And it's also really important, and that's legitimate. We want to recognize it and really solidify it. But at the same time, we also want to remember that these are resilient, vibrant communities of older adults and others who have survived a lot already in their lifetime, and are worth us celebrating, particularly as we think about AAPI Heritage Month this month.
Yeah, I think for me, what I think about is continue to keep the AAPI population visible, right? And so at the Alzheimer's Association, we release an annual facts and figures report. And this year, our special report talked about race, ethnicity, and Alzheimer's in America. And for the first time, we included Asian American perspectives on Alzheimer's and dementia, in addition to Blacks, Latinos, and Native Americans as well. So, continue to keep the AAPI population visible in our work is critically important.
Thank you. So I am going to go ahead. That mute is just getting me today. I just wanted to offer to everyone, I'm dropping something in the chat, which is something I've been sort of watching the conversation for several years, which is something called Nonprofit AF. led by Vuli, and he's really challenging some of the ways that we operate as nonprofits and the cultural norms and the things that we simply accept as part of the nonprofit landscape, from contracting and grant making and how our organizations operate. And I want to really encourage all of my colleagues to be looking at that. And really just sometimes I don't agree with everything he says, but I sit with it and I understand where he's coming from and sort of the broader narrative. And so that's just something, tiny thing that I'm doing. So I want to ask all of our attendees today to pick one thing you're going to do for you and one conversation you're going to have with your organization about how you can be more responsive to the AAPI community, how you can have some tough, challenging internal conversations and embark on this journey like what the Alzheimer's Association and Justice in Aging have done. I want to thank all of you for coming today and making this time. We will be back next month to close out our first year. We will be welcoming back Paul Greenwood, who will be talking about elder abuse and how to bring that out of the shadows. And as you know, Paul has been with us several times over the course of this last 12 months and has brought a lot of learning and information to us. So the link is just dropped in the chat. I hope you'll be the first to register, and we will see you back here next month. My sincere thanks to Denny and Edie for taking this time and leading us in this conversation. I wish all of you a happy and healthy month. And remember, there's still time to do some work, investigation, and observance of AAPI Awareness Month. So look forward to what you learn. Thanks so much.